hear me? Can hear me or not? You want me to take out my mask?
Yes.
Yeah, because I got very sexy voice, you know. So, okay. Good morning, everyone. And first of all, thank you, Dato, for your presence here, for your support. And also thank you, Dato, and also doctors and ladies and gentlemen. First of all, I would like to apologize for my such a sexy voice here that will make you wake up and try to open up your ear to listen to me. Yeah. Okay. So thanks, Suli, for your introduction. Next slide. My assistant. Okay, it's okay. Yeah. So today I'm going to tell you about the needs, why there is a need in this integrative approach, right? And at the same time, of course, we want to know that what is so different in this, what we are coming up with this Malaysia Mind Body Medicine Practitioner Association. And at the end of it, we also talk about the tools and modalities. And of course, we are also inviting our founding members to join us because we are now opening shop. Okay? And we are looking for people, and for the first group, we are looking for the founding members that we want those people who can work together with us to kickstart and run journey together. It is not like we cannot get anybody just to come in, right? Okay, next slide. Next. Okay. You believe that mind and body are connected?
Yes.
Yeah. Who say mind is mind, body is body, and even the mind and the brain are actually also the same thing. That in those days, in the 80s or before, it would be actually the old studies where we actually separate it out, right? So now, if we are following that kind of the path, it means we will go into the wrong track. So it is very important for us to know that everything is non-negotiable. Your mind and your bodies are interconnected, right? And we are also connected with what? With all our five senses as well. You see what happened if I pinch you? Do you feel the pain? Mind. That's because you have the sensory there, right? And sometimes we know that this sensory is telling you, they transport to your mind to tell you that, yes, I am actually having the pain. So that is the receptor that is giving us the answer. What happens if, let's say, we cannot see the ultraviolet light and so on, because I don't have the receptors. So it's very important that every one of us has got different things, and we have all our five senses, which is actually very useful for as a human being, right? And we need to treat ourselves as a whole, and we cannot be separated as no, your mind is mind and body is body. And what happened to me, why I got interested to it is because although in medical line was very happy, yeah, life was good, until then my mom has got breast cancer, and she survived 22 years without chemotherapy, no radiotherapy, right? So she's living happily. And from there, once she passed away, my dad developed Parkinson, right? And it's so different compared to if you are healthcare professionals in the hospital. You only take care of the patients and you don't bring homework back. But when it comes to your own family members, what happened? I never get better. Right? And then we know all these drugs has got a lot of side effects. And what happened? I had to start searching for other solutions. I start to look out for answers, and I become what they call me the witch doctor. Right? Why witch doctor? So they name me Dr. Mad. Mad because my name is Madalene, and maybe in short is Mad. Mad stands for make a difference. Okay? So I want to actually make sure that they are actually getting better. But of course, I can't say that because of the drug and so on, because I have to admit it. But at the same time, I cannot stand it because I know he developed hallucination. He got a lot of so-called nonsense, but we just don't know how, right? So he was very, very negative, and I had to, someone introduced me about the essential oil, and what happened? I started to use, the neuro-auricular techniques. That's what I learned. And he started to become more positive. My dad was a very negative person. He never said thank you. Okay? And he never appreciated anyone. And whoever comes to see him, he will say, this one is like bringing soy to them. So it's like black magic. So I kind of a bit angry inside, but then what to do? So until one day I applied the aromatherapy, and my aunt, who's the one who took care of him, and she called me in Penang, and I was in KL, and she said, you know what your dad did? I said, what? He said, thank you. No, to me, thank you is nothing, right? Anytime we can say thank you, but to her it is something which is so big, because my dad never said thanks to her. Right? Even when I went back home, he would push the dishes to me, say that you should try this dish, it's very nice. And then my aunt is the one who cooked for him. So that time he really made him so feel proud. So these are the feelings and emotions that's coming out. So from that itself, actually my aunt started to take good care of him. Right? Before that, we had a bell, just as like treating it as like a hospital. We have a bell, you can ring anytime you need help, and he would ring non-stop until my aunt also ignored him. Say, just ring until the child come home, so he will not come to see him. So what to do, right? So I cannot be there all the time. So that's what I see, that is a difference in terms of emotions, right? Another one is my son. My son is ADHD, yeah. And every time when the teacher say, your son is so naughty, so active, and so on, I say, oh yes, so sorry, I understand. I don't know what to do. So and I have to go out and learn. I learn what? Energy medicine, right? Then I go back and run energy to my son. And my son said, Mom, what are you doing? I said, I'm running energy. I was so happy. And really true enough that he got the best achievement award for that particular year. From the last, he became in the middle. Not first, of course, yeah. But it's that moment itself, I feel so proud. And he came back, I still remember vividly in my mind, it's like he told me, he said, Mom, you know or not, when the teacher mentioned my name, I almost fainted. Yeah. And then for a 10 years old boy, he was so proud of himself. And then, of course, that makes the mom happy as well. Right? So that's where I started to look up. There are so many things out there. So we cannot just depending on one modalities alone. Right? Okay, so next. I don't talk so much, right? Okay, so we all need that is addressing. We need to know that this modern lifestyle, everything, we do not want to be like, just go on, and then after the age time, we suffer. Of course, we want to grow old gracefully, right? Just like what we have our models here. Yeah, so who do not want that when you are getting much older, and then you still be able to do what you want? It's not that, that when we grow old and say we're waiting for someone to come to see you. So waiting for the time, right? So this is what we want. We want to until the end, so that we value our life, and that's what we want to do. So this is next, and of course, is this what we're choosing for? The lifestyle itself is like you want to be able to move around or waiting for someone to look after you. So, but in the modalities nowadays, people are looking out for to ease your chronic pains, to ease for if you have any problems, negative, make you into positive, and any kind of things to make them actually why? Because the mindset is positive, right? I involved with a few of the NGOs, and I do realize that those patients who are positive mindset and also having a very good family background, you can see the family support them. The patients, they actually doing fantastic, right? And those who are not, you can see that really is kind of hopeless, even though they are so young, right? So we need to know that the mind is so important to us as well, right? Even though physically we get affected, but of course we just don't want to stay just waiting there. But that is a limiting belief we need to clear. So we need to know. I have a friend in Singapore, he was paralyzed, neck down, and he was blind. He was diagnosed with multiple diseases, okay? So you name it, he has multiple sclerosis, you name it, all kind of things he has. And he was telling me it is just like lying down in the coffin, and because he was blind, and he was still alive. That kind of feeling, you know. So, and then he is a molecular biologist. So what happened to him? As a scientist, he got a lot of friends. Everybody come to him and say, well, look at the scientific evidence. You know that 99.999% is incurable. So you got to accept it. So are you going to accept it? But he is someone who is different. He said he still got 0.0001% that makes him a difference, right? And he goes into energy medicine. And that's why I was asking him, how did you do that? And now he's alive, he got a beautiful family, and kicking around, right? So this is something different that we see life. What do you want to see? It's not that, you know, sometimes when the doctors, we do have to diagnose someone, but sometimes when diagnosis itself, I don't know, sometimes people will say, a doctor come back and tell me that I got depression. So I get my stigma there, right? So label that, yeah, I always got depression. Go everywhere, tell people I got depression, right? Or I got whatever you have, whatever the doctor say you have, you just like spread the word because you have. Why are you looking for empathy? Or what, right? This is something that you need to look for. Is just don't take it that, you know, I have this issue, I got anxiety case. So forever your anxiety will never settle. Right? It's important for us to know. So we don't label, and we need to actually work it out together. Okay, next. This is the whole concept that we only see the doctor, only you listen to me, and you listen to me, I provide you the treatment, and you go home. That's it. Right? Is that what you usually do? Right? So what is the thing that we need to do now? But in the holistic way, what we need to do next? Next slide.
This is a great one.
Yeah. So normally, of course, in a holistic style, that we need to have a both side communication. We let the patient decide and come up with a solution. What is best? And let the expert and also the patients come up with a solution, and let's work together. And that's how we can make things more meaningful, right? So this is very important for all of us now. And even with the new healthcare system, so modern, we also need something that with the personal touch, right? And this is very important when you have face-to-face talking and somebody who trusts you and understands your overall. And this is what you see me as the whole patient, right? I remember my dad, he was suffering from, after taking the medicine, he passing blood stools, right? Then from neuro, refer to gastro. So the gastro, no, will take over. The neuro say it's none of my business. Now gastro have to take over. So whose problem? And then I only take care of that part. I don't take care of your overall. But you are a human being, right? So are you treating me as the whole, or you're treating me only as a small little part? So this is what we need to think, right? Okay, next. So overall, what we are doing here is that in the modalities, whatever we are doing, it definitely has to be evidence-based, scientific proven, and we need to also work together from the mainstream, work together with the complementary and alternative medicine, work together to enhance the treatment, and of course it brings the healthcare, the treatment forefront for all the patients, right? This is what we are looking for, right? Okay, next. And so just share some vision. My voice also running out. Okay, so you can see my vision here. I don't need to read already. Everybody just read. Keep my voice low.
Preserve your voice.
Okay, we actually envision a society that individual can access integrated healthcare services that addresses both physical and mental well-being and leading to a fulfillment healthy life, right? And of course, our value is, of course, integrative, evidence-based, and also empowering. Thanks. Of course, here, our mission here, right, just now, we integrate all this mind management. We are actually putting in to, at the end of it, we want to provide education, research, and also advocacy to meet up with, so that we can make us shine. Okay, next. So the aim, the objective itself, we also want to reach out to those who really need help. And of course, we collaborate because I may not be good in one modalities alone, right? There are so many modalities out there. And you know, because to tell you something, my father is also a feng shui master lah. Okay? So he does metaphysics. So I understand about all these element stuff, right? So you know that everything that you may have more of this, you maybe have to talk about the data, right? And then you have less of this, then you focus, right? So in overall, whatever we are doing is the same thing. We need to actually, maybe that person already have enough of the certain elements, so-called, and then we just need to look out at what this person really needs. That's it. So that is what we say about collaboration in different modalities, right? So I will say that only my modalities works alone. Okay, next. Yeah. So this is what we do. We provide training, we provide educations, we come up with different things. And of course, research is important because we know that whatever we are doing in a healthcare system, we need to have evidence-based so that to provide the support to whatever you are doing, right? Advocacy itself is that we want to look out to change the, come up with the policies and also with the insurance coverage and so on. So these are the things we are looking at. Next. Okay. Just now I mentioned about community outreach and also collaboration. Okay, next. We have, because I have my time is running out. Okay, so in the field itself, we have overall, we are focusing on the inner-based practice, where we actually upgrade your own belief system, right? And of course, we are focusing on the subconscious and unconscious mind. We're using all these different modalities. But of course, you have your modalities that actually can put in that is related to my body. You're always welcome, right? And next we have is we also incorporate with the mind body based practice, which actually is looking into how we can actually make it anti-aging, right? Returning around with God. And of course, mindfulness, and of course, we talk about intellectual behavior therapy, compassion-based therapies, and also sensory psychotherapy. Okay. So, who we want to reach out? In fact, we really want to reach out to everybody who really think this is necessary for them. Okay. So, it's that overall, it doesn't mean that it has to be only you must be somebody. But if you think this is actually something that related to you and brings you that is a need for you, then you come and look for us, right? And then next. Of course, we do have in our modalities, we are teaching, and in terms of the learning, we actually come out with a lot of different modules, and we're also looking forward to actually, in order to help patients to really know how to actually use it, not only and overall the mind and body alone. Of course, the diet part itself, it also plays a very important role. And of course, other than that, the behavior, emotions, and so on. My voice is getting more and more sexy. Okay. Of course, we want to keep our standards. That's where we adopt the methods of grades. Right? So in the modules we are looking into that we want to apply grades into this assessment so that you can keep the quality of this curriculum. So for the first ever start event, after this launch, in July, we are having a mindfulness training. Okay, this is also for those it can you be certified as a teacher certification as well. It is a 5 days course. To find out more, you can learn about it outside. Okay, so I don't need to elaborate more. Okay, next, of course, everything, so make up a nice music, right? So everybody, your music, you're very good in certain talents. Of course, we are looking out for founding members, right? To come and find out that how you got your own strength. I'm not the only one that I'm saying that I am good at, right? Okay. Next, I want to leave behind with one story. I'm sure that everybody knows about these 5 blind men and also the elephant. You all heard about it, right? So what is it? The analogy here itself is what? It's only by listening and dialoguing, right? Together, we must understand that you would say that this is looks like a rope, this one looks like a snake, this one looks like tree trunks. So, and overall, when we discuss, then only we know how the whole elephant looks like, right? So it is the same thing that we also looking into. This is how the healthcare looks like. That how we all work it out together in this holistic way, and how we can reach out to our clients and our patients. Yeah. So for that, I would like to end my session. Terima kasih.